Hi, good morning. I know I look rough. Please excuse me. I'm on my way to surgery this morning. But I just wanted to make a quick little video about my situation. First of all, I'm Cindy. I'm a retired disabled vet, and I'm doing this because I usually have a chain, but I had to take off my jewelry because of the surgery. I suffer from a condition called endometriosis, and well, it's a disease, and not too many people know about it because it's not cancer. Not too many people talk about it, but it affects a lot of women, and a lot of women suffer from it, and they do not know because it goes undiagnosed. My story began like while I was in the military. I had a lot of menstrual cramps. I had a lot of pain, and as a lot of women been told, if you just have cramps, just go take some Motrin, you'll be fine. But with my condition, what happened to me was I was having ovarian cysts that kept rupturing. So I was always in pain, and I had to keep going to the emergency room because it was like every other month I had an ovarian cyst that would rupture. Long story short, I got medically retired from the Army, and when I went to the VA, I had 2 cysts that refused to rupture. So they got big. They were like 10 centimeters and one was 6 centimeters. They were both in at the same time. So at that point, they had to have surgery. So when the doctor went in for the surgery, after I went for my follow-up, he came back and he said, "Miss Henderson, I do not know how you were able to walk around in this much pain." I'm like, "What are you talking about?" I'm like, "I thought I'm just having normal cramps." He said, "No, you have severe endometriosis." At that time, I have no idea what endometriosis is. That's when he explains to me that endometriosis is when the lining of your uterus is growing on the outside of your uterus. Nobody knows what causes it, how it happens, but it just happens. For those who don't know, the lining of your uterus is when a woman is getting ready for a baby, her lining of her uterus thickens, and if the egg doesn't get fertilized, then that sheds and becomes her menstrual cycle. So what happens in women like me, since the lining of our uterus grows on the outside of our uterus, every month that we have a cycle, wherever the lining is, it thickens and then it sheds wherever it is, inside our uterus and outside of our uterus. So, and then it creates lesions. It just does crazy things. So when he went in, at that point, my fallopian tube and my ovary on my left side had already fused. So it was like one thing. I don't even know what to call it. So at that point, he wanted to remove my ovary, but he didn't have my permission. So we decided to continue because I was, I think, 32 at the time, and he didn't want to do a hysterectomy because he was like, "You're still young, you could want to have kids, so I don't want to do a hysterectomy. We could do a partial," but I'm like, I don't want to be living with one ovary, and what if the endometriosis spread to that? So we decided to try different treatments. At this point, we have tried everything. It has gotten to the point that they have even forgotten what treatments they have tried, and they are ready to start back again from the beginning. So he has sent me to a endometriosis removal specialist. Yeah, they have them out there. So today I'm going in because it has spread. The last time we did an ultrasound, it looked like the endometriosis has spread to my urethra. This is the line from your kidney. So we actually had to do I can't remember the name of the procedure, where they had to insert something and go into my kidney to make sure that the endometriosis has not gotten inside my kidney. So, but that was about 1.5 to 2 years ago. So, because since we did that procedure, we saw it wasn't in my kidney, we started a different treatment regimen. So right now, today I'm going in. I have ovarian cysts, I have a fibroid, and of course the endometriosis. So we're going to remove all that. We're not sure how far else the endometriosis has spread because the ultrasound can only show you so much. We're not sure if it has spread to my bladder or my kidneys yet. This thing can spread as far as to your lungs. Some people have had it spread to their brain. This is crazy. This is a very serious disease that a lot of people do not know and do not talk about. So I'm just doing this just to raise awareness of how serious this condition is. You can bleed to death. It's something serious. So I will keep you guys informed. As of right now, it's supposed to be hopefully for me, I'm hoping it's a simple surgery, go in and clean out whatever we can and call it a day, and I should be home tonight. But you know, with my doctor, the way he sounds is like, okay, we're gonna go in, and he's pretty sure he might have to cut a piece of my urethra out, because based on what we saw before, he said he think he can handle it. But if he sees anything on my bowel or anything else he can't handle, he's going to stop the surgery immediately. And he has a team that comes in to do extensive endometriosis repairs. So he would stop the surgery, and then we would have to keep me overnight to reschedule me to do another surgery. So I'll keep you guys informed, and thank you for listening. Bye.